Um, a little bit stressed, which is why I'm here, and because I like taking care of things myself, it's a little bit awkward to lay out on the table all that's going on in my life right now.
Mm-hmm.
So I'm probably going to sound a little bit cheerier about what's really going on than what's really going on. Um, so you'll probably need to help me get a little more real in what I'm telling you, because I know that I need help untangling this, and doing it myself is just making it more and more stressful.
That makes sense.
So I don't really know where to start. What do you need to know first, and then we can go deeper?
Well, you definitely came to the right place because we really specialize in helping adult brain injury patients, and I understand that you had a stroke recently. Can you tell me more about that?
Yeah. I am really young as a stroke patient because I'm only in my early 50s, and this was not a typical stroke. It started with me thinking that I had vertigo, where my balance was just really off, and it just sounded like the classic symptoms of vertigo. And even talking to my friends, they were like, oh, just, take this medicine over the counter and take a decongestant. And as I tried doing that, things were actually getting worse instead of better. And when it got to the point of me throwing up, I actually had a different friend who said, let's go and get this checked out and make sure that it's only vertigo. And so we went to like an immediate med type place, because this was during just regular work hours. And as they kind of talked with me and asked me some questions, they felt like something more serious was going on, and that wasn't the answer that I wanted to hear. So we went over to the emergency room, and they felt like I was having a cerebral stroke, which I'd never even heard of. There's a fancier medical name for it. But they actually checked me into the hospital and started doing all sorts of testing. And when the doctor came in and talked to me, I was shocked about how serious it was, and yet how lucky I was that it was not a worse stroke than what it was. So there's a bit of a grieving process in all of that, and yet you also feel lucky that things aren't worse than they are, and yet felt stupid that I didn't recognize that something serious was going wrong, and grateful that my friend said, let's go get it checked out. So I know things happened the way that they were supposed to in terms of the timing. But what happens with this type of stroke, because it's a cerebral stroke, that means the blood clot was in my brain. And so what I'm noticing in myself is, even though I look fine, I'm not like a typical stroke patient where, half my face is sagging and I can't use one arm and one leg. Because I look the same as I did when I was at work before the stroke, people assume I'm fine. So it feels embarrassing to me to park in a handicapped parking space. It feels embarrassing to me to take a cane with me for stability because my balance has been affected a little bit. Probably the biggest thing that I noticed that I actually talked to my doctor about was that I feel like I'm feeling emotions a lot stronger than I should. Because normally I think of myself as like a calm, patient, even-keeled person. And suddenly anger feels way too strong. Sadness feels way too strong. Frustration feels way too strong. And so I know I'm not thinking and feeling things the way I used to. And most of it I can hide and compensate for. But I'm also getting tired more easily. So a normal work day that I could have done and it would have been just a normal easy day is making me a lot more tired. And when I'm more tired, the emotional ups and downs get even stronger. And so it's getting harder and harder to hide it at work. And that's what worries me, is how do I be realistic about not trying to just jump back into daily life? How do I explain to my boss and my coworkers what's going on inside of me that they can't see so that they're more empathetic and understanding, but I also don't want to make it look like I'm whining and complaining, because that's not me either.
Right.
So it's just this big jumbled up mess. And so I'm laying this huge thing in front of you. That's all of it pouring out. And I guess I need somebody that can help me kind of sort through it and figure out some ways that I can create some relief in my own thoughts and in my own feelings and in the amount of work that I'm carrying.
Mm-hmm.
But someone who can also not just give me a free pass where I just decide to take 6 months off from work. I want to try and keep doing normal things, but I also know that the way I've been trying to do it, of just walk it off kind of mentality, is making things worse and more stressful for me internally, and it's coming out in ugly ways that I just don't like feeling that way. So I need to do it differently, and I don't know what or how. So I'm going to look at you and smile and know that if you don't know the answers, or that you would have access to helping me figure out how to do this, or who to talk to, or books to read, because I'm to that point where I'm at the end of what I know to do.
What you're saying makes a lot of sense. It seems that you're feeling a lot of confusion and anxiety, that your life has changed all of a sudden when everything was fine before, and you have all these new challenges to conquer that you feel like no one else is helping you with, and that no one understands because they can't see them like they would with other disabilities.
Yeah.
And I totally understand how you would feel that way, that's a lot to deal with.
Well, the other thing too, because as I'm listening to you say back to me what you're hearing, I'm realizing that another big stressor for me is when you go through something big like this, and the bills from my hospital stay and all the testing are starting to arrive, and I have a health insurance plan that has a high deductible, and so the first $10,000 is out of pocket for me, where I'm paying for that before insurance starts helping.
Right.
So I've got these big bills arriving in the mail. I did have to take time off from work while I was in the hospital, and then they've slowly worked me back into my schedule of working back up to being full-time, and yet I realize that with the strong emotions that I'm feeling, I'm typing emails with a lot more sharper language than what I need to. When I'm upset, me pounding on the keyboard is getting kind of obvious to my coworkers, and and my tolerance for my boss changing what they're having me doing, I'm getting a lot less patient and understanding, and I guess what my big fear is that if my mistakes keep growing in terms of how I'm dealing with stress and other people, I might get fired. And if I get fired, not only am I losing my income, but I'm losing my insurance benefits. And so I think that's the real stress, is if I don't figure out how to do this better and explain what's going on in an appropriate way to my boss and my coworkers, that I could potentially make the mess even bigger, because I don't want to be dead weight on my team, and I feel like I can do my job, but right now the struggles are coming out in ways that I don't like, and because I look okay, I feel like people are not going to be empathetic, because it's going to sound like I'm making it up, if that makes any sense.
That does make